Hello, and welcome to the StellaLife Innovator Series. I'm Liz Lundry, and today I'll be talking to Dr. Jay Neugarten. Dr. Neugarten is the oral and maxillofacial surgical member of the craniofacial team at New York Hospital Cornell-Weill Medical Center. He's a nationally known specialist in oral and maxillofacial surgery and works with patients from neonate to adult requiring both complex implant and bone grafting construction, as well as those whose skeletal, facial, and craniofacial deformities require corrective jaw surgery and distraction osteogenesis. He's a published author and a national and international speaker, and I'm so happy to welcome you, Dr. Neugarten. Thanks for joining us today.
Good day, Liz. It certainly is a pleasure, and I look forward to spending this time with you and just chit-chatting with you.
Great, thank you. And the work that you do is so important as you're saving people's lives with the corrective surgeries that you provide so they can function normally, and you're changing lives when people have deformities. It's really amazing and so impactful, of course. Tell us more about your practice focus.
Yeah, so I'm an oral maxillofacial surgeon. I practice in Manhattan, New York. Part of a group of six doctors. We have three offices, two on Long Island and one in New York City. And our focus is really what I would call the tertiary care approach, tertiary care to taking care of patients who need major maxillofacial surgery, from something as simple as a biopsy or a tooth removal to more complex procedures such as orthognathic surgery, cleft, craniofacial, and distraction osteogenesis, as you spoke about, joint replacements, zygoma reconstructions, really spanning the full gamut of oral maxillofacial surgery, from the simple to the complex. But I say our focus is a couple of things. Number one, empathy, and really caring about our patients and their needs. And many of them come in with despair, no hope, either having had treatment before and not gotten good quality care, or just not knowing where to go and where to begin. And taking someone who is dysfunctional and giving them a life or their life back is certainly the reason why I do and what we do. And seeing these young babies grow, develop, mature, who have airway issues, or taking an adult who can't chew properly, speak properly, articulate properly, or breathe properly, and give them a new lease on life is why we do what we do.
Yeah, that's so incredible. So tell us about a couple of cases and what you've done for some of your patients.
Yeah, so taking a baby who's born early on to a family, mom, dad, and a family that's been diagnosed with sleep apnea and can't breathe, or they're told they can't go out of the hospital, or they're told that they're, all of a sudden, a month out, they begin to choke because they're not feeding properly. And we diagnose them with a small airway. And we've had a number of patients like this. And to see them at a young age where we grow their lower jaw to get them to breathe and eat better, and really getting them back to their family unit, getting them to play with friends, getting them to grow and mature. There is one particular kid who is now 13 years old, and his mom still sends me photos and holiday cards. And to see this young baby that I met at 1 month old to now grow and be a major impact in the family and just this mom's joy of life, and to see this kid educate, grow, and be, just an amazing young man, is why we do what we do. I mean, that's just one of the areas. And another one is a young woman who had hemifacial microsomia, a crooked face, and really off, and did not know where to go, and had seen many surgeons. And about a month ago now, we took this young lady to the OR, and by you doing jaw surgery on the upper and lower, we needed to take a piece of her hip, but to grow the jaw on her left side because it was really swung over to the opposite side. and she saw her orthodontist, and the orthodontist was just, enamored and blown away about how it just fits her and it looks like it's normal now, and she's breathing and speaking and articulating. And here was a young girl who was so shy, so hand over the face, really withdrawn, and just socially. And now she walks into the center of the room, and mom says she's gleaming with confidence. And that's what life to me, and that's what oral maxillofacial surgery means to me and is to me, is to really uplift patients and make them the best that they can in life.
Yeah, that's so satisfying for you, and just making that impact on these people just feels so great. It's so wonderful that you can do that for them and then see them grow and be in touch with them and see the impact you've had. And you're really progressive. You're doing these incredible clinical procedures, which seem like fascinating to me. But also, you're using telemedicine in your practice. Tell us how that's working for you.
Yeah, so telemedicine has been something that, as a result of COVID, an incredibly bad time in the world for people and affected a lot of families. But from that, for me, really taught me that it can be more than just face to face, kind of like how you and I are now. And the ability to take a practice for me that was local, regional, or national has now gone to the international, even to the West Coast, has really given people who didn't know where to get care, or a different kind of care, or wanted something that connected a little bit different, for the opportunity to take care of patients beyond, and even regionally. If I have someone who's going to travel 2 hours to see me for a post-op, they don't need to do that anymore. So the telemedicine appointment has been so impactful for patients who want to see us, who have limited time, but it is so resourceful, super successful, and super powerful to be able to make things better for everybody, my time, their time. So telemedicine has certainly been something that has been very, very, very positive for us to be able to take care of patients at a higher level of care, especially for those that are short on time.
Yeah, absolutely. It's also good for the environment. So that's really good.
100%. Yeah.
That.
Yeah,
So
sure, for
yeah,
sure.
that is excellent. So we're really seeing more of that, and it just makes so much sense. So one of the positive outcomes of the pandemic, I suppose, getting us to use these
Probably one of the
platforms.
only ones, yeah, for
But,
sure.
you do so much. You're a mentor to many as you teach doctors how to place zygomatic implants, and as a clinical instructor for oral and maxillofacial residents, and you lecture on topics such as distraction osteogenesis, which I find absolutely fascinating. Can you describe the courses that you offer to doctors?
Yeah. So another big thing in my life is mentorship and to give back. Not only do I give back to patients, but I love to educate people, because I didn't get here alone. I had mentors in my life, and mentorship is so big in every aspect, whether it's in surgery or publishing or journalism or anything that we do. I always tell people, remember, we didn't get here on our own. There's always someone that was impactful. And if I can impact other clinicians and give back, it means the world to me, and it's what drives me and motivates me. And we run a number of courses on implant therapy, orthognathic surgery, and I even in my residence, I'm an instructor, professor at Cornell, where we have 3 residents a year to be able to progress and become, I become mentors to them in the oral maxillofacial surgery world. But here at our office, we run a course through Zaga for implant reconstruction. It's a multi-day course, and we run it throughout the year, along with our orthognathic symposium to educate orthodontists, and again, give back, mentor them, and really give them what my saying is. I want to be able to give you tools that'll impact your Monday morning when you return back to work, to be impactful and to really be effective for you.
Yeah. I'm also an educator and a lecturer and teacher, and that's exactly what I want to do, is make sure they have something they can take back right away. But we've had many mentors, all of us, and to be able to help others do this, what we do as well, we're helping so many more patients that way. So you're really, really giving back by doing that. And These courses sound fantastic. You're also a StellaLife provider and, work
Yeah.
that into your protocol. Tell us about how that's changed your practice.
Yeah. So StellaLife came into my practice 2+ years ago, almost 3 years ago. And prior to that, we were using chlorhexidine and Paradex, and we know some of the impact of staining teeth and fibroblast inhibition and stuff along those lines. And along came the StellaLife product, and the feedback from patients have been overwhelming. I mean, certainly from a mucosal healing to a sense of freshness and cleanness, and for me, inflammation and wound healing in the jaw surgery patient, in our implant patients, in our pathology patients, in our vesiculobullous disease, in our oral pathology patients, to the point where they feel so affected in a positive way that they get more of it and more of it and more of it. And that to me is the most important sauce, if you would, is how patients feel about something. And we use the recovery kit, which is the gel, the spray, and the rinse for our orthognathic patients. And for me, it also gives me a sense of confidence because I know they're getting good care, but I'm not staining their teeth. So on multiple levels, between the essential oils that are in there, the inflammatory mediators that it helps to reduce, the way patients feel about it, it has been one of the biggest impactful products that we have brought on over the past few years that has really made a big difference moving our patients and moving the needle.
Yeah. No, as a clinician, I love giving them something that I know works and also tastes good. It's pleasant to use,
It's a
so
win-win. It's a win-win. Yep.
totally, totally. Well, thank you so much for being a provider for StellaLife and also for all the amazing things that you do for so many people, including the doctors that you're training. So keep it going. And thank you so much for joining us today. And we really appreciate you. So
Thank you for
everybody,
your time, Liz. It was a true pleasure.
thank you. And thank you all for joining us. Join us next time where we feature another fantastic innovator like Dr. Neugarten on the Innovator Series. Enjoy and stay well and stay happy.